this year I like a lot the motto because my topic of interest is mainly addictive disorders, addictive behaviors, including eating disorders. And this is the type of disorder for which we need a lot to integrate a large variability of findings and very difficult to understand scientific studies. And you know, for the EPA, we are very lucky for that because we have a lot of this kind of information that really being translated into something that we can really use in everyday practice. So for example, for eating disorders, we had to integrate those findings on genetics and epigenetics and why the BDNF, a neurotrophic factor, could be involved in anorexia nervosa, for example. We had these studies on imagery, especially that the nucleus accumbens is being activated when you see somebody very thin, so a kind of reward abnormality rather more than a phobia. And we also had some studies on the neurocognition, especially with this delay discounting, which seems to be very specific in anorexia. All those findings are completely different from different fields. So it's very nice that we are able now to innovate, which means integrating all those different aspects into something that can be very concrete. And that might mean also to individualize those treatments, because those, for example, that might be more on the very late delay discounting should be more appropriate with remediation cognitive therapy. And for those for which you have more impulsive behavior, maybe mindfulness would be more appropriate. So you see, we have this kind of nice way to gather a lot of different information, giving it sense to clinical practice, and then use it to specify exactly which patient needs which type of approach.